One of the most wonderful things, most remarkable things that ever happened to me in my political career as a Member of Parliament was when I was on a train going to a speaking engagement in Stoke-on-Trent. And a gentleman came up to me and said, could he introduce me to his children? And he took me over and I met his wife and his two children. And he said, my children suffer from Batten Disease, and it's thanks to you that they're still alive. This was the most flattering thing he could possibly say. It wasn't entirely true because I had worked with a group of other MPs, Labour and Conservative, to campaign for a drug to be provided to these children, including his two, that NICE at that point was not funding and which it has decided not to fund again. The first campaign, as I say, had the support of Labour and Conservative MPs. The then Health Secretary, Matt Hancock, was sympathetic, and the Speaker, John Bercow, was very good at allowing parliamentary mechanisms to be used to make the case. Adjournment debates, urgent questions, a Prime Minister's question, all of these procedures were used to make the case for Brignura to be paid for. And it succeeded, and since 2019, children with Batten disease have been receiving this amazing, life-giving drug. Let me explain a bit about Batten disease and about Brignura, the drug involved. Batten disease must be one of the hardest things for parents to bear because after a child is born, the child learns to talk and walk, and then it unlearns it. That the disease clicks in and the ability to speak goes and the ability to walk goes, the sight goes, and the child's life expectancy is limited to the early teenage years. It's as if dementia has started in a child. It's an irreversible disease, and it must be, as I say, such a painful one to bear. But the drug Brignura managed not quite to stop it in its tracks, but certainly to delay its evolution, its development, and give these sad children an extra period of good, enjoyable quality of life. Indeed, the quality of life given is so good with the drug that it exceeds the models that NICE uses to evaluate whether a drug should be paid for. It's even better than their models can cope with. It's given by infusions. Why I met these two children. They'd been coming back from hospital, having gone in there to receive the drug by infusion, and it has a very high success rate. It's used in the United States, it's used around the world, and NICE agreed to fund it in 2019. But now, NICE has changed its mind. They've said they cannot afford the cost. And I accept the cost per patient per year is high. It's over £500,000, but it's only a very small number of children, a handful of children who get this disease each year, diagnosed with this disease each year. It's not going to bankrupt the NHS. Indeed, NICE could probably afford it if it made some savings out of its £76 million a year annual budget. And the fury that I think people are entitled to fear about this is the way we waste money in other areas. That if all the money in the NHS was spent well, and if they said that, well, we can't afford this because it would blow our budgets, then they might have an argument. But we know how much waste there is. I've already mentioned the 76 million NICE spends, but I've got a little list of other things where money is wasted that is so much more than would be spent on giving Brignura to children with Batten disease. So 250 million over the last 5 years in England on procedures for transgender, non-binary and gender questioning patients. Which is more important, somebody who doesn't know whether he's a boy or a girl, or somebody who has a disease that will kill and will ensure a very low quality of life towards the life's ends. This year alone, or the 10 months of 2024-25, that was 88 million. What about healthcare tourism? What about all the healthcare that is given to people who come into this country illegally and get immediate healthcare and dentistry and the works which we don't, but health tourism, which is estimated to cost between 110 million and 280 million pounds a year. Treatment to foreign visitors that isn't recouped, 1.8 billion pounds a year. Oh, and then the diversity roles. We love all of those, don't we? Let's have lots of DEI officers wandering around pontificating, possibly as much as £40 million a year. For Brignora, a few £1,000,000 a year is all that is needed, and it is a life-saving drug. This is what is so tragic and so infuriating about it, that NICE is sentencing children to die. If you think of those old films where you've got the scene at the Old Bailey, and there is the judge putting on the black cap and saying that the person in the dock will be taken from this place to be hanged by the neck until he is dead. The sentence of death is being passed by NICE on these children. It is outrageous when there is so much waste. It is a true national scandal. I urge Wes Streeting, the Health Secretary, and as it happens, a very decent man, to intervene to tell NICE to get its priorities right. This is so important. As I say, I got involved initially because I was representing a constituent. As I found more and more out about it, felt that it was such an obvious thing to be doing, such an important treatment for children who deserve the chance of life. A NICE, an unaccountable, unelected, classic, blobby bureaucracy with fat salaries, spending millions of your money, presiding over waste throughout the NHS, is not willing to save a few children. I just think this is so dreadful, awful, evil, that it ought to be stopped. And these children ought to be given a chance of life that is of good quality. And you know, as they live, other treatments may come through which will extend their chance of life even further. How can that be denied to them? How can the waste not be reallocated, savings made in other places, to look after this small number of children every year? I'd encourage you to write to your Member of Parliament, write to NICE, take up the cudgels on behalf of this small number of very deserving children and their parents. Thank you.